Hello everyone, this is Paul from Ortho Eval Pal. Today I want to talk about tibialis anterior tendonitis, or tendonitis over the inside top part of the foot right in this area over here. So what is tibialis anterior tendonitis? Well, there is this large muscle that comes down the outer side of the lower leg, and that muscle turns into a tendon. That tendon comes right down here, and as you can see, if we pull the foot up a little bit, you can see that tendon nicely. It attaches right here at what we call the medial cuneiform and the first metatarsal right there. Those two are the attachment point and help to hold the arch up. So what does this tendon do and what does this muscle do? First of all, it helps to pull the foot up toward your face. It also helps to turn your foot in at the same time. You can really see that tendon popping out right here. The other thing that it does is, because of its situation orientation here, is that it helps to support the arch. So it helps to give some stability right here. All right. So in regards to that, that's how it functions. Now, what causes an anterior tibial tendonitis? Well, it could be multiple things. It could be that somebody has increased the mileage of walking or running and just moving that ankle a lot more. Maybe going down a decline quite a bit, because when you hit the floor here and the foot drops, this tendon has to work really hard to help hold the foot from slapping really hard. Other reasons that you can have this is poor footwear. Maybe the laces or the inside part of the shoe is just rubbing there. It might be a new pair of shoes and it's very unforgiving. That can give you some discomfort there. And then trauma is really the next reason why you could have problems in this region, because of things like, I had a patient recently who was like 35 years old, played in an alumni soccer game, did a lot of kicking of the soccer ball, a lot of running, which she had not done in a long time. This became very inflamed and irritated. So trauma, overuse, poor footwear, and some biomechanical, overuse to that foot and ankle. So what are some of the signs that you might have a tibialis anterior tendonitis? Well, first of all, you might notice some swelling right where it attaches right here, and it'll be very isolated to where that tendon comes right onto that bone. The other thing that you might notice is that there'll be a significant amount of tenderness right in this spot, right where it attaches, okay? Not necessarily up the leg and not necessarily under the foot, okay? So it is important to rule out other things like posterior tibial tendonitis, plantar fasciitis, and a stress fracture to this bone, and maybe even arthritis in this joint right under here. But when it's swollen and tender right there, that is probably going to be the biggest sign of having a tibialis anterior tendonitis. The next thing I do is I have the patient pull the foot up and in, and usually just pulling it up will cause some pain there, but then I'll give some resistance. So I'll hold against that and make that tendon work a little bit, and that can be very painful. The other thing is, if we relax the foot and ankle, we turn it down and out, the exact opposite position, we put a big stretch on that tendon, and that can be painful also. That's called selective tissue tension testing. If you contract it and you stretch it and they both hurt, it's more likely to be tendon related or muscle related. So those are pretty much the test that I do. The other thing I'll do is I'll have the patient walk on their heels. So pull the foot up in the air and try to walk on the heel. And that will be extremely painful right there, because the body weight is trying to push the foot down and it's trying to hold it up. But when they walk on their tiptoes, as you can see, the tendon is very relaxed here. They have no pain in that region because it's completely turned off. All right. So what do we do about this early on? Do we have home remedies that you can do at home? And yes, there are many things you can do, especially in the early stages. All right. So understanding what caused it in the first place. If it was overuse, maybe slowing down those activities. Maybe you bought a new pair of shoes. And here's an example. If you have a shoe that has a very hard sole to it, when that shoe strikes the floor, it is going to pivot really quickly here, and the shoe is going to waterfall quickly. That muscle on the front is going to work even harder. So you might migrate into maybe an older shoe that you've had that has a softer heel, it's kind of worn down a little bit, or something that just has a little more cushion here, so that when it strikes the ground, the heel sinks a little bit. That tendon doesn't have to work so hard. So it's a kind of an indirect way to help it get some relief. Another way to help decrease that inflammation is to take something like a non-steroidal anti-inflammatory like ibuprofen, Motrin, Advil, something like that. I would definitely run that by your medical provider and or your pharmacist just to make sure that it's not conflicting with any of the other medications that you might be taking. And if you have, stomach problems and things like that, you probably don't want to do that. But it can be helpful when this inflammation is acute and starting up right away. The other thing that I like to do in an area like this at home is to use something like a Voltaren gel that has a non-steroidal anti-inflammatory in it also. You just take a little bit, rub it right on that area. The reason I would use something like that on this area is because the tendon is right below the skin, right next to the bone, so it doesn't have a lot of tissue to penetrate through. I don't like using creams and gels and things like that on areas that have more muscle or more adipose tissue or things where there's a lot of callus. It doesn't penetrate very well. But in an area like this that's very close to the skin, I definitely would use some sort of rub like that a couple times a day. Now, we also talked about this arch collapsing. So I want to, early on, I want to try to support that arch a little bit, maybe with a pair of sneakers that has a good arch support, or even getting just a simple orthotic that is a corrective orthotic. So it's important that when you put on an orthotic, that it is solid enough and it's trying to support the arch. So as you can see here, when we put this over here, this orthotic is going to nicely support that arch. Therefore, this tendon that has to work really hard to hold the arch up doesn't have to work so hard anymore. Okay, so, and it doesn't need to be a custom orthotic or something that's super expensive, but just something that will support you here. Not a rubbery, cushiony type of orthotic that just absorbs shock. Okay, we want something that is going to be somewhat supportive. That early on can also give this tendon a rest. What we don't want to do is completely do nothing, get on crutches and do nothing. If you can't put any weight or maybe take 3 or 4 steps, you need to be concerned that you might have maybe a stress fracture in there or something like that. So if it is so severe you can't put weight on it, you probably should see your primary care provider or go to the emergency room and have an x-ray to make sure that that is not fractured in there, there isn't something else going on there. But those are some of the simple little things that you can do at home. Some people like to heat or ice. Ice can help decrease pain, but ice does not decrease inflammation physiologically. And there's really not a lot of research about either of them being very helpful. But if heat is a little more comfortable and you feel like you can move your foot better, that is fine. You can go ahead and do it. If you're getting some comfort with ice, that is okay also. The other thing you can do if you don't have an orthotic or some sort of a support is you could take tape or some sort of a wrap and grab a hold of that arch here and pull that tape up along this tendon and kind of hold the foot up like this. So it simulates what that tendon has to do. Now that will give that tendon just a little bit of a rest so that it is not absorbing all of the pressure of that arch collapsing inward. So that can be beneficial also, and there's really no harm to doing that. Now what we're gonna do is we're just gonna take a break for a second, then we're gonna get into some more aggressive strengthening exercises to help support this arch a little bit better and to get some tension into this tendon, which it needs to ultimately support your body weight. All right, now that everything is kind of settled down, there's a little less pain in that tibialis anterior tendon, and you want to start to get active again, you want to start to kind of rehabilitate and get this foot and ankle a little bit stronger. The first thing I want to do though is I want to improve the flexibility of the calf. So a slant board stretch is the #1 way to go when trying to optimize that calf flexibility. So go ahead and hop on. What we do here is the foot stays flat. We improve the stretch here. I like to do this with the knee straight for this particular problem because this is when you're bearing most of the weight that is being driven through your arch and when you come over it. So the knee is going to be straight. So I tend to do this calf stretch in this position. I like to do the stretch for 30 seconds. I like to step off and or do it on the other side. We do 5 of those and we do them 3 times a day. Now our next exercises are going to be toe curls. Now the reason I like to do this is because I want to help strengthen up the muscles on the inside of the foot a little bit to help support that arch, especially when you're standing right up and on it. So the way you do this is you take those toes and you keep the heel in place, you put it on a washcloth or a towel or something like that, something on a slippery surface, and then you start to grasp that towel, okay? So we're working those little muscles on the inside underneath the arch to help support the arch. But here we're starting to turn on this anterior tibialis or tibialis anterior tendon right there. So what I typically like to do are 10 scrunches where you're trying to pick that up. Another way to do this is to pick up marbles and put them into a cup. That helps to get those toes working really hard. So you just push it back. So 10 scrunches, 10 times. I like to do that once a day. All right, we're going to show you another arch supporting exercise, and we're not going to stress that tibialis anterior too much just yet. What we're going to do is we're going to get the posterior tibialis tendon, which comes down and around here and helps to support the arch also. The way we do this is we sit with this knee at just a little bit less than 90 degrees. We keep it at this little slope like this. Imagine there is a pin coming up through the heel. You take a piece of TheraBand or rubber band or anything like this, and you put it underneath the leg of a couch or a table or something like that, and you try to pull the foot inward, keeping the toe down along the floor. Okay, when you do that, you're actually activating this tendon back here a little bit more and not the one that we are working on. We're getting a little contraction here, but it's not a real harsh contraction yet. We would typically do 3 sets of 10 repetitions of these and then take a break. That you would only do once a day. Now we're going to start to activate this tibialis anterior a little bit. We're going to keep that band tied down here near the edge of a table or a couch or something like that. And now what you're going to do is you're going to turn the foot up and in and rest right there. So it's going to be a hold. You set a timer, you hold this for 45 seconds. It can hurt. You might have some discomfort from 2 to a 4 on a pain scale, and that is all right. As long as when you do these exercises, you might have a little discomfort during it, but you're not miserable after and you're not miserable the next day. It's a very good exercise to start doing. So you go for 45 seconds, your timer goes off, you rest the foot for 45 seconds. And then I'm going to reiterate this one again because this is a very important part of starting to load that tendon to help get some pain relief and to start to build some integrity of where that tendon attaches to the bone. So we are going to pull up and in again like that. We really see that tendon working hard here. This is an isometric. If it hurts to go too high, you might lighten up a little bit and start like that. Another 45 seconds. We do 5 of these with a 45-second hold, 45-second rest. These you will do once a day. All right, and now to conclude our exercise program in our home remedies for how to treat tibialis anterior tendonitis, we get into something a little bit more advanced now. So what we're going to do is we're really going to make that tendon start to contract by working on standing in one spot. You might even be able to put your back up against the wall to make this work harder, and you're going to lift the feet up off the floor and back down. Trying not to rock back and forth, but just lifting the feet. I would do about 10 of these. I would take a rest for 15 to 20 seconds and do it again. I would do that for 3 sets. Now, if you're able to tolerate this, things are starting to come around for you, okay? You can start to become a little bit more active. You can start to increase your walking mileage, slowly increase your running. You can start to attempt to go downhill, which is going to work this tendon a little bit harder. And so if you are not starting to see some improvement with this by taking care of this yourself, be sure to see your medical provider to get maybe some advanced imaging, maybe get an orthopedic consult and have that checked out. But I hope this video was helpful in taking care of your tibialis anterior tendonitis and tendonitis on the top of your foot. Please subscribe, and thank you for watching.